classmates. Welcome to a presentation resultant of an interview with Marcy Mundo, a Master of Business Administration who received her degree at CCU and works at UC Health in HR in Colorado. Healthcare reform is a topic of huge proportion, and this presentation will highlight just a few topics relevant to employment law, system reform, and Ms. Mundo's administrative position. The first two topics will pertain to employment law, including whistleblowers and paid leave of absence. The last three topics will pertain to system reform, including methods of payment, Centers for Medicare and Medicaid Innovations Act of 2010, and the expansion of Medicare and Medicaid. First, whistleblowing law. While only some states provide protection for persons reporting violations of crime, otherwise known as whistleblowers, Colorado has added themselves to the list of states that do. Whistleblowing is further protected by retaliation protections of Title VII, which is an extension of the Civil Rights Act of 1964, which prohibits retaliation. Put into practice, Ms. Mundo has this to say. At UC Health, we have a retaliation policy which protects the right for employees to report concerns and to not be retaliated against in any way. When an employee reports a concern that involves me talking to the employee the complainant referred to, we give them the policy and talk in depth about retaliation. Next, the Family and Medical Leave Act and the Americans with Disabilities Act. The FMLA and the ADA are two major guides for administrative activities, such as granting time off for terminally ill family members. Ms. Mundo further explains these provisions for employees at UC Health. She says an employee can get paid during their leave if there is not a relief employee and if they qualify for short-term disability pay. They can also use their PTO to get paid while out on leave. Now let's spend a little time on the topic of system reform. Much speculation is centered around FFS and the potential lack of integrity generated because of excessive services being rendered. Further criticism suggests that healthcare outcomes are hurt by the loss of not practicing preventive medicine in place of expensive services. Ms. Mundo indicated that she personally never questions compensation models because, she says, we really don't have much of a choice on how we get paid. This is mandated by government and through what insurance is willing to pay us. The accrediting organizations, CMS, is important to HR administrators, and recent passage of quality improvement programs initiated through CMMI are meant to positively impact an organization. I asked Ms. Mundo about any impact on UC Health CMMI had, but she responded that she had no information to relate, indicating to me that HR administration does not generally have involvement in following the programs implemented by measures such as CMMI. So, the question that greatly impacts those working in both the public and private sectors is how will expanding Medicare and Medicaid to cover more of the population, otherwise known as universal health care, impact employment? Her answer The projected reimbursement rates will decline each year, and we already run on thin margins. This answer indicates to me that current employment will not see much in the way of increased compensations due to the increased need to grow the workforce, who possibly will receive somewhat lower salaries than expected. Thank you for watching my presentation. We covered topics of healthcare, reform, and employment law, and how they relate to the job of an MBA in HR administration in a nonprofit hospital in Colorado. I hope you enjoyed it and will find the information useful.